Shadow Health Secretary Victoria Atkins is with us this morning. Good morning,
Good morning.
to you. Trying following sausage rolls and champagne and bongo cards.
Bongo, the cart, I know. I can't hope to top that.
Well, let's see how we go. Let's start with the fact that you will not have your new leader in place for this budget. You should, surely.
Well, we wanted to take some time after the election to reflect on what went wrong. You know, we acknowledge and understand that the public sent us a very clear message on polling day, and so we wanted to take a bit of time to make sure that we elect the right leader for the future. I have absolute confidence in Rishi Sunak being able to scrutinise and, I suspect, reveal the gaping holes in this Labour budget, and so I'm really looking forward to him delivering the answer for us on Wednesday. But I am deeply, deeply worried about what we are hearing about the proposals for this budget, because it seems that it's shaping up to be, well, it's shaping up to be a budget of broken promises. The Labour Party didn't promise much in the general election, but they promised two things. First of all, they wouldn't fiddle with the fiscal rules, their words, not ours. And secondly, that they will not raise national insurance, VAT and income tax. And
on working people.
On working people. They have announced that they're going to fiddle the fiscal rules. They did it overseas, presumably to try and keep the markets quiet at such a seismic change. But now we're hearing that the Labour Party don't actually understand who the people they claim they're trying to protect, who those people are. The idea that the small business owners in Preston that we've seen on our screens are not working people is for the birds. So why on earth is this Labour Chancellor seeking to saddle them with higher taxes, which will no doubt get passed on to everybody else? Why are they trying to do that when they have said to the public they would do no such thing?
Because you left them with a bonfire of public services.
Well, again, with that, we will, we as Health Secretary, I was very focused on reforming the NHS because I think we all acknowledge it needs reform. Investment has to be married with reform. And this figure that they have concocted in July, which was the reason that they claimed they had to slash winter fuel payments for pensioners, again, going after some of the most vulnerable in our society. Apparently, they're going to continue this Wednesday with the cut to the £2 bus fare. We don't. But the briefing that has gone out ahead of this budget, of course, as a former Treasury Minister, I acknowledge there's always a little bit of briefing or speculation that happens before a budget. But this has been weeks of sustained briefing by the Labour spin machine. And what we're hearing now is extremely concerning about the impact of these taxes on the economy as a whole. And we know that they have real-life impacts because only this morning we've seen that business confidence is plummeting for the fourth month in a row because people are genuinely worried about what's in store for them on Wednesday.
OK, well, the former WHO Cancer Chief, Carol Sikora, says the NHS is utterly dysfunctional and simply doesn't work. How much of that is your responsibility? I
think I came into politics. The NHS was one of the reasons I came into politics because whilst I've seen some brilliant parts of the NHS in the way it's looked after me over my lifetime, I've also seen some of its darker corners. And so I, as Health Secretary, wanted to start that reformation journey, and we did so with the announcement of the productivity plan at spring budget, £3.45 billion of technology, AI innovation that will have the potential to really open up the NHS app and so on. But what worries me is that after 14 years of opposition, we've had 4 months of dither and delay from Labour, and it's taken them 4 months to announce a public consultation, which is going to take another 6 months to be conducted. So again, there's just swathes of time where there's a lot of rhetoric, but no real action to make the changes to the NHS that I'm sure we all want to see.
Do you think it's a good idea to ask people what they want from their NHS?
Well, again, I think there are some, we felt there are some obvious areas that need reform, so that is why we brought forward the productivity plan. The truth is that we have more doctors, more nurses and more funding in the NHS than at any time in its history. We brought forward the long-term workforce plan to train up the staff that we need for the next 15 years of the NHS. But this dither and delay, and I'll give you a really good example, the tobacco and vapes bill, That bill is ready to go. You know, we were halfway through it before the general election was called. We've now had 4 months of nothing. And we still have pretty much every minute of every single day, someone will be walking into hospital with a smoking-related condition. And so what I don't understand is, after 14 years of opposition, why is it that we don't see any action other than
take you 14 years to get there?
This scaremongering with the budget on Wednesday. In terms of, I mean, we were promised actually on the NHS, and I think West Streeting used the words oven-ready plan. Where is that plan? And that is what I...
Echoing Boris Johnson.
That is what I am focused on, you know, now in my shadow role. But we want to see, of course we want the economy to flourish, of course we want the NHS to flourish, but what worries us is that this constant narrative of talking down our economy, talking down our public services, that is having a real-life impact. And they claim that they want to grow the economy, but of course, no one that I know of in the cabinet has any experience of starting a business or growing it. So they say one thing and then do the very opposite for the ends that they claim to want to achieve.
Ozempic, should it be available on the NHS in order to get people back to work?
So I think there's definitely a role for Ozempic to play. Of course, it already has a role as a medication for type 2 diabetics. But in terms of weight loss, yes, I was very keen on seeing the potential for that, but we cannot escape the fact that a great deal of the problems with obesity is because we need to have a conversation and understand how we can eat better, how we can exercise more. These are tough messages, but we have to have that as part of our healthy living plan. I very much hope and expect at some point we'll hear something from the new Health Secretary on prevention. We were in the middle of preparing plans for that, and then the election was called. But there is something here that we have got to deal with, including, for example, looking at the role of ultra-processed food, whether that is having an impact on how we're absorbing calories and so on. But Ozempic is part of the answer, but it can't be the whole answer.
Okay. Another couple of things, if I may. Where are you on the assisted dying bill?
Well, I've said when I was Health Secretary, I was very
You absented yourself last time, didn't you?
I did, because I was conscious then that I would, as the Health Secretary, be responsible for making the change happen if it were to happen, or indeed preserving the status quo. I'm very much listening, actually. I haven't ever spoken publicly really about assisted dying. I want to see the evidence that advocates are bringing forward for change. I think we all acknowledge that if a change is to be made, then it will be a huge, significant change in our relationship with healthcare providers, whether it's with doctors or clinicians who are administering the substances to bring about someone's death. We have to do this, I think, in a very, very careful and considered fashion. So at the moment, I'm in the rare position of saying I'm listening to make up my mind. I don't want to act on without understanding the full range of evidence on this.
Okay, you're supporting Robert Jenrick, of course, to be leader. He's been on the show incredibly outspoken about the killing of Chris Cabba. Yeah. He said no one should be mourning his death. Do you agree?
Well, the reports of what that individual did before the incident, and of course the police officer has been acquitted unanimously by the jury in a very, very short space of time. The incidents that are reported show that he was clearly a member of a very, very violent gang. Anyone living in that part of London...
But should you mourn his death? I mean, think about his mother.
Well, it's always difficult with cases where, of course, families will grieve the loss of a loved one, but then when I was Justice Minister and when I was a Minister in the Home Office trying to tackle these gangs...
You've been around, haven't you?
I have been around. We have to think of the wider implications on society. So it's not just that family that we need to think about, it's the families of the children that these gangs are recruiting to move their drugs around the country, the girls that they are sexually exploiting, but also using their bank accounts in order to launder the proceeds of their crimes through the girls' bank accounts.
I hear you.
And I feel so strongly about this. I'm actually bringing forward a private member's bill on creating an offence of child exploitation, because I think there is a very, very pernicious crime where both adults and, I'm sorry to say, also older teenagers groom children into these gangs, exploit them because they think the police won't search them. I've been on many a raid with police officers where they've said they use children in order to avoid the children being, they think the kids won't get searched by the police. It's very cynical and very exploitative.
It's not appropriate to say no one should be mourning his death. Think about his family.
Well, again, we have to be, although of course there is a family here, I am also very, very concerned, I know Rob is as well, about the wider ramifications. And there should never be, and I know you're not suggesting this, but there shouldn't be, we shouldn't be looking back through rose-tinted spectacles at the behaviours of these gang leaders who commit terrible, terrible crimes and hurt so many people.
He was a thug, but, his mother's grieving him.
It sounds as though he was more than that, but again, I'm conscious I'm relying on press reports. I wasn't sitting in the courtroom and I haven't had access to police files, but certainly the reports show he was a very, very serious criminal, and I find it difficult to shed tears for such people.
OK. Quick thought about the former suspended Labour MP attacking people in the street?
Well, again, I appreciate your views may find this frustrating. I'm trying to think of what may happen with the police investigation and, in any event,
you've seen the video.
Trial. I've seen the video. It is shocking. I won't comment more on that precisely because I don't want to in any way put the investigation or the trial at risk. You know that I've prosecuted cases. I've had cases where...
But if you look at
in my previous career, it is shocking. It's shocking. It is shocking. And I think what is concerning is that the first video came out, I think, Saturday morning or Saturday afternoon. It took a little bit of time for the Labour Party to act. That is disappointing because obviously the video speaks for itself. But we'll have to let the police investigate this and for things to run through to their natural conclusion. But that is a very worrying. And also, of course, for the Labour Party, Mr Ainsbury was one of the attack MPs in the House of Commons chamber. He'd be always up on his feet supporting ministers and attacking the opposition. So I suspect they'll feel his absence in the chamber as well.
OK, but again, I've just seen that full video this morning for the first time. I was away at the weekend. A grown man representing his constituents.
Well, as I say, I mustn't trespass, although I'm very tempted to. I mustn't trespass, but I found that video very, very shocking. We'll have to let the police investigate and see what happens. I have to say, this weekend, whilst I've been in my constituency speaking to my constituents, they have been very much focused on the worries they have about this budget. And then you have this on top of those genuine concerns about how the budget is going to hurt them, their families and their businesses. I don't think the Labour Party is in a very good shape this morning.
OK, it's good to see you, as always. Thanks very much indeed. Thank you.